A simple blood test, costing under £28, could boost the diagnosis of heart failure and save the NHS £3.8 million. Experts have argued the test should be made available to all hospitals and GPs in England to speed up diagnosis and save the NHS millions. The recommendation is one of 10 included in a report published today, which follows an investigation into the debilitating condition that costs the NHS around 2% of its total budget. The simple test, NTproBNP, developed in the late 1990s by BHF-funded researchers at the University of Dundee, is used to detect levels of natriuretic peptide in a patient's blood and either rules out or point towards a diagnosis of heart failure. Despite current recommendations by NICE, the inquiry exposed that access to testing is variable across the country and in some areas is not commissioned at all. Estimates suggest up to a third of GPs and a third of hospital trusts do not have access to natriuretic peptide testing. Patients with a very high level of natriuretic peptide in their blood have a poorer prognosis and should be referred for an echo and specialist assessment urgently. Analysis by the watchdog National Institute for Health and Clinical Excellence, NICE, showed nationally the net saving resulting from the use of the test in primary care, GPs, was predicted to be £3.8 million. In one area, the experts said the number of echocardiograms and referrals were reduced by around 50%, which led to savings of around £15,000 per month. The inquiry, prompted by Westminster's All-Party Parliamentary Group on Heart Disease, APPG, heard evidence from patients, healthcare professionals, and commissioners to find out how to improve outcomes for people with heart failure. 10 recommendations were put forward, which include that all patients should receive specialist input to their care and better monitoring of the workforce who deals with heart failure patients to ensure that there is sufficient resource to meet demands. More than 400,000 people in England have been diagnosed with heart failure, and there are likely to be many more undiagnosed cases. Stuart Andrew MP for Pudsey, Horsforth, and Aireborough, who chairs the UPGON Heart Disease, said, "Many people with heart failure receive excellent care and there is a lot of good practice and service innovation across England. However, many others do not receive the care that meets guidelines, and this can have a considerable impact on their lives, often resulting in unnecessary early death. We hope that the recommendations in the report will make a real difference to people living with heart failure and will help the government and NHS to meet some of their objectives around reducing hospital admissions at a time when cost effectiveness has never been so important." Professor Andrew Clark, Chair of Clinical Cardiology and Consultant Cardiologist at Hull University, who co-chaired the advisory panel to the inquiry, said the care which is offered to heart failure patients can greatly increase their life expectancy. He added, "Treatment is relatively simple, relatively cheap, and can dramatically improve outcomes. We are keen to see the recommendations in the report implemented as soon as possible to ensure that heart failure patients are receiving the best standard of care, wherever they live in England." Simon Gillespie, Chief Executive of the British Heart Foundation, said, "Heart failure is a devastating condition which leaves sufferers constantly short of breath, unable to continue to do the work and activities they once enjoyed. Our research has helped to drastically improve heart attack survival rates, meaning 70% of people now survive. However, many are left with irreversibly damaged hearts, meaning a life sentence of living with debilitating heart failure. We urgently need to fund more research into heart failure to find new and better ways to prevent, diagnose and treat this cruel condition. But we must also improve quality of life for those currently suffering with this condition, and we are keen to work with the government and NHS to achieve this." Watch more videos at video.5la.net.